Mr. Horsford.
Thank you, Chairman Buchanan, and to the Vice Chairman, Mr. Davis, and to the Ranking Member for holding this hearing today and welcoming me back to the Subcommittee on Health. I am eager to get to work on the issues that matter most to the people of Nevada, such as expanding healthcare affordability and accessibility, promoting health and tax justice, and creating opportunities that enable every family to thrive. Specifically, my goal as a member of the subcommittee is to advance policy that promotes equity in our healthcare settings. This includes working together to pass my bills, the Mental Health Transparency Act, which would bring more transparency to the behavioral health care space, the School Professionals Act to fix a long-standing loophole that has prevented contracted educational support staff from accessing affordable health care, and the soon-to-be introduced Dependent Income Exclusion Act, legislation that aims to make health insurance more affordable for families with children who have part-time jobs or are enrolled in job training programs. Now, on the issue of social determinants of health, earlier this year, the Nevada Division of Public and Behavioral Health released the first ever statewide health improvement plan, addressing long-standing challenges and inadequacies that have affected the Silver State while offering several policy recommendations to improve the health of all Nevadans. The Silver State Health Improvement Plan focuses on 4 key priorities: addressing social determinants of health, improving access to health care, expanding mental health and substance use disorder services, and transforming the public health system. Now, Nevada is not alone with these priorities, and it's crucial that the state does not face these challenges in isolation. As federal lawmakers, we must continue to advocate for innovative and forward-looking policies that support our advocates and those who need this support the most on the ground. Dr. Gearhardt, the Silver State Health Improvement Plan emphasizes the importance of reducing food insecurity to address social determinants of health. Could you elaborate further on the importance of enhancing food security to the social determinants of health and suggest ways that lawmakers can address structural inequities, especially those affecting underserved communities?
Yes, food insecurity is a huge and growing issue in America, and particularly we're seeing in communities, Black communities, Hispanic communities, Native American and rural communities. It's a bigger issue. A lot of us have spoken here today that there's been a focus on food insecurity where it's just about getting access to calories, but we've all kind of been emphasizing that it'll be important for these sort of programs to also think about that people can get access to nourishing foods, really nutrient-rich foods. In my own lab, we've seen that there's multiple factors about food insecurity that sets people up to have unhealthy relationships with their body and with food in general. Part of that is that it's highly stressful to not have enough money to get the food you need to nourish yourself and your children. And that stress leads to inflammation and exacerbates many of these chronic health conditions that we've been talking about today. We also see that for many of these families, there's this kind of intermittent pattern where you'll get access to some funds at certain parts of the month, but then you run out. And so many family members will actually starve themselves, skip meals to be able to feed their children or to feed other members of their family. And then when the resources become available again, it can trigger this kind of binge pattern. That's really our biology that's been set up to help us protect against famine being used against us in a modern food environment. So having consistent, reliable access to affordable, nutritious foods will support not just the physical well-being, but also the mental health. And we see in our lab that experiencing food insecurity as a child, even if as you become an adult, you now are food secure, that experience in those critical times of your life as a child when you didn't know if you'd have enough nourishing food to eat, sets you up not just in the context of diet-related chronic health disease, but also substance use disorders increases risk for that. So we really need to focus on the nutritional security of our children across the entire United States.
Thank you so much for your answer. I look forward to working with members of the committee and the staff and all of those advocates out there who support public health. Thank you. With that, Mr. Chairman, I yield back.